The more you face, the more you overcome. In this session, I share anxieties and fears around COVID-19, plus 7 tips for surviving and thriving.
Welcome to day 3 of the Nurses Week celebration, Stress and Crisis Management. This program is for you. Please enter the chat and tell us where you're from. Let us know what questions you might have. And when prompted to do so, please also participate in the poll. We'd like to hear from you. We want to know your concerns, and we want to best meet your needs. So let's look at the coronavirus. Impact, it's global. It's global in nature, although in each and every city that you represent, I'm sure that you feel that it is impacting someone you know. Someone you know has the virus. Someone you know is in survival stage. Or even worse, someone you know has passed. The status of testing is unknown. Some of the tests are good and some of the tests are not. Some of the tests are readily available and some of them are not. Diagnosis is still an issue, treatment is still an issue, and now availability of medication is also a huge concern. Places like Mass General and other large academic medical centers revealing the fact that they do not have access to drugs. So it's a challenge, the challenge to caregivers, and it's also a challenge to our future because we have no idea what the future holds. Let's look at that concept of stress. Which of these is stress for you? Is it anxiety? Is it fear? Is it loneliness for those of you who are still at work? How do you feel each day when you enter that facility? How does it make you feel? Anxiety because of separation, because of absences from your classmates, from your colleagues, and from your community. Anxiety perhaps because of distancing, social or physical distancing. Which one is better? We're at the point in time where social distancing meets social anxiety. And we expect a proliferation of all kinds of mental health and emotional challenges as a result of what's going on right now. It's 100% normal, absolutely normal, to be worried about contracting or spreading COVID-19. Here are the facts. The virus is contagious. Experts say the rate of infection is 2 to 3. That's high, but not measles high. It's still high. The problem is that symptoms can spread before anyone even knows if they have the disease. This morning I read in the Washington Post that there are so many people who believe that they've already been infected and already had it and are in recovery phase, but they didn't know that they even had it. So the question is, how many people did they connect with during the time that they were contagious? No one really knows. Nothing is really normal. We're not used to seeing empty grocery shelves. I saw them, I'll be honest, the first year that I moved to the DC area. After being in Chicago for 30 years, I wasn't accustomed to shortages of anything. It snowed, but everyone knew that if you didn't clear the snow and allow people to navigate, you would never get reelected mayor. That's basically the politics of the city and how it worked. So I moved here, and I remember my son saying to me when I went to buy groceries, "Mom, be sure that you get there early, the lines will be long." And I thought, why? I went to the store and I was shocked to see lines that went from the cash registers all the way back to the meat counters. And I was astounded by the empty shelves and the fact that people brought suitcases, real luggage, filled the luggage with groceries and were carting those suitcases home. One woman I heard bought 48 cartons of milk and then tried to return them after the big storm. Of course, the store wouldn't take them back. But I was absolutely astounded by the way that people responded to a threat of 1 inch of ice and perhaps 2 drops of snow. It really was amazing. But yes, this has taken its toll. Depression and boredom are norm. How many times do you get bored throughout the day thinking, I cannot look at another TV show, or I cannot read another book online, or I cannot do one more thing or answer one more email? There's anger, there's frustration, there's irritability, and this trio of feelings has its root in the fact that we've had to relinquish control of so many things all at once. It's not mandated, it's not directed toward people like the man in the grocery store who loaded up his cart and took everything, took all the toilet tissue and you can't find any, but it's basically a generalized frustration. So what are the triggers before COVID-19, the triggers to stress, or perhaps overwork, or too many hours spent, or not enough sleep, or lack of hydration? But what are they now? Chances are that the concept of too many hours remains. For those of you in the clinical space, you are working an exorbitant number of hours. You are working harder than ever before. And more importantly, you are at great risk. You are risking your lives each and every day so that those around you can remain safe. So I ask you to think about for a minute, what is stressing you right now? Is it too much or maybe too little time? Is it your family and what disease you'll bring home to them? Is it transmission for yourself or for others? Is it the fact that you just are not getting enough sleep because you simply are overwhelmed? And stress has a huge price tag, not just in human lives, but in more. So when we get to polling, we're going to start to answer these questions. So what is it costing you? And what can you do? What can you do next? It's costing you in terms of your family, personal boundaries. If you're working from home and you have other family members there with you, you might find that being together all day requires that you set some specific rules and boundaries for how to approach this new setup. Are you homeschooling in the same room in which you're working? Is that also the room in which you're cooking? Many of us live in smaller spaces or confined spaces and don't have the freedom and the joy of moving to a 15-room house where everyone gets their own space. I've never been in that situation. Time boundaries. Hear about the time that you need to work and the time that you need to relax and have time for yourself, as opposed to time you have to chat or eat together. If you take medications, make sure to work that into your daily plan. Spatial boundaries. Adjusting to spending 24 hours with the same people is a real challenge. Even if you really love those people, you love them dearly, but 24 hours, 7 days a week is a lot of time spent with the same people, whether they're your family members or your roommates. You may find that you need some personal space to be alone, and honor that. There's no need to feel guilty or think it means you don't like your family. It means that you can honor the personal needs of others. I smile when I think about that, because when I was growing up, there were 4 girls in our house and we had a single brother. He said that he never got space of his own. He had to go into the bathroom and sit in the bathtub to find his own spot. Whatever that spot might be for you, wherever you can manage it, honor it. And then there are material boundaries. If you're sharing a TV or other devices and household items, create clarity around who's allowed to use what when. Not every child has access to that Chromebook and can do their homework at the same time. And then emotional boundaries. Many of us are experiencing heightened anxiety under these circumstances, and it could be helpful to set aside a little bit of time to share your feelings collectively, to say how you feel each morning, to say what you're grateful for, and to make it work. And then digital boundaries. You've heard me say that Zoom is on overdrive. So is the internet. So is every other mechanism of communication. And these are unprecedented times. Things are different, and we're all challenged. So look at those relationships that you share with others, those with whom you're connecting on a personal and professional level, calls that you're making to parents and grandparents, some of whom may be in extended care facilities or nursing homes, and you're trying to connect with them and be with them, and you worry about them, but you really cannot see beyond that glass window or beyond that screen. And then there's your health. We can push our bodies and our minds so far before they fail us. Fatigue countermeasure programs must be offered by employers. In healthcare, they have to provide adequate staffing, ensuring breaks in meal periods, even when you're working those extensive hours, offering sleeping accommodations, even like a recliner in a nap room, establishing nap policies. The employee's responsibility is to obtain sufficient sleep prior to beginning a shift, and sometimes that's hard. So we need to train staff, assess and reduce risk, define performance indicators, and investigate sentinel events. We all have a stake in the challenge, and we're all, each and every one of us, part of the solution. And what about your productivity? We all want to do the best job possible, don't we? We want to perform at the highest level. We want to succeed. We want great outcomes for all of our patients. Sometimes the environment itself impairs our ability to do that. When I worked in Eastern Europe, I remember that my nurse colleagues didn't have healthy work environments. They barely had work environments at all. At the time, they worked without electricity, without an emergency generator, without adequate food for patients and staff, and in less than desirable conditions. Someone from the States had donated an MRI machine, but without a generator and no power, what good was that MRI machine? People had no food. I remember looking at a piece of bread on the windowsill that was covered in ketchup and had a dollop of cheese on top, and someone told me that that was pizza, and it was baking in the sun. And so when they served that pizza at lunchtime, what could you do but eat it? Because if it was good enough for everyone else, it was good enough for all of us. Do what you can with what you have. Do what you do best, do what you love, meditate when needed, and you celebrate your successes. I still recall seeing a full-term infant pass away because it wasn't possible to control the baby's body temperature. Candy, you can relate to that as a NICU professional. It wasn't possible to maintain the temperature in a nursery that was as cold inside as it was outside. But the nurses with conviction did what needed to be done, and they performed at their very best. That's what's expected of you today and every day. And then there's fatigue, because this takes its toll. Clear thinking, critical thinking, and clear communication are imperatives in all settings, in all professions. We're challenged more than ever before with the effect of fatigue on outcomes. Fatigue is a reality in nursing, isn't it? Every day, during every shift, nurses can experience fatigue of their minds, bodies, and spirits because of workload, work hours, and so much more. And now it's become an even more critical problem. Plus, hospitals have noise. It's certainly not the place to go for an extended rest. There are certainly many more patients than there are beds. And alarms contribute to an environment that poses a significant risk, not just to patient safety, but also to outcomes. Who owns this level of fatigue? Whose responsibility is it? It's a shared responsibility. It's dependent on optimal work environments and reducing our risk. So as an employee or as a student, what can you do? This is the environment in which you work. What's your role? All employees are responsible for practicing healthy behaviors, for making sure that they come to work rested, that they arrive at work alert, and that they can promote a self-commute to and from work because they're not overtired. That means that they have to get some rest. They have to be hydrated. They have to have what their bodies and minds need. And our bodies and minds are unique, aren't they? We all have different recovery times. For one of us, 5 hours of sleep might make it, and for others, it's much longer. You need to be aware of your own recovery time and know your own limits. And then your employer is also responsible because they can shift the paradigm. They can create a positive culture. They can express a clear and compelling vision. During the crisis, leaders have the difficult and opposing responsibilities of keeping their people informed while also compelling them to remain calm and focused on solutions. And while some leaders we see, not just in healthcare, but throughout the world, are excelling at this, others are exacerbating the situation through contradiction, through perhaps false claims, through a lack of a cohesive strategy. We all need that strategy. And then there's your institution or your healthcare system. The outcome is only going to be as good as the system. And the system has been created to ensure positive outcomes. So how do you do that? Attach a sense of urgency. You partner with staff. Listen to your staff. Create a collaborative work environment so that everyone feels a part of it. You educate and empower staff, and you identify the areas and practices that may result in fatigue. You develop that countermeasures program that is so needed. Look carefully at staffing and scheduling practices, and you offer an opportunity for feedback and ideas for improvement. You engage staff in recruitment and retention activities, and you promote innovation that comes from within. So what's the impact of fatigue on us? Well, it's cognitive. It's our inability to focus and poor memory and confusion and judgment. And it's emotional. It's how we feel internally. It decreases our motivation. It sometimes makes us irritable. It impairs our communication. And it really does contribute to stress. So stress is all about that mind-body connection. Mind and body are connected. when one experiences disruption, they both experience disruption. Take care of your mind and your body through stress-busting techniques like meditation, deep breathing, relaxation, napping, hydration, and so much more. You're all familiar with that stress cycle: alarm when you react to the stressor, resistance when you adapt, and exhaustion when you are unable to resist or unable to go on. But with you, as nurses, as caregivers, the more you face, the more you overcome. So I'm going to ask you, because so many people are anticipating high school graduations virtually this year, to think about the approximately 3.7 million high school seniors for whom natural trauma has been a constant in their lives. They were born right after 9/11. They were fifth graders during Sandy Hook, and they were sophomores when a gunman attacked Marjorie Stoneman High School in Parkland, Florida. The country has been at war since they were born, and the current war, the coronavirus pandemic, has reinforced life lessons that change happens. That's one more change for them to overcome. When you think about what you've overcome, think about these young members of the class of 2020 and what they have been through. So there are contributing factors: staffing schedules, workloads, commuting times to and from work, rotating shifts, perhaps having to live somewhere else and apart from your family while you're working, simply because you cannot return to that safe environment and run the risk of infecting others. Rotating shifts and personal health, what we all need to survive and thrive. We need to know that we are counted and that we are important in the big scheme of things, and that everyone values the contribution that we are making. And that's what Nurses Week is all about, but frankly, that's what every day is all about, because in my opinion and that of many of my peers, nurses should be valued and respected and recognized every day in every way possible. It's no longer acceptable to have you running on empty. Ways to combat that: 7 tips. Hydration with water, not coffee and tea. A decent night's sleep. Be well nourished, and that does not mean inhaling your fast food at the nurse's station, even if you only have 10 minutes a day. Taking a nap when needed. Exercise, even if it's only moving those joints. Relaxation, and of course, a focus on self-care. Putting yourself first. In the same way in which you make appointments with others, pencil some time into your own calendar or note it on your smartphone. This is my 15 minutes for me today, and I'm going to take that time to be good just to myself. So what works for you? Do you know how to relax? Focus on things that relax you. Focus on deep breathing. Do you visualize something that is relaxing? When I see people post pictures on Facebook and they're in the mountains or in the valley or somewhere beautiful and there's a great rainbow, I'm wondering where they live, where I perhaps do not live. I'm looking at the city and they're looking at really magnificent settings. But whatever it is that makes us feel good, that's what we should be doing. And then be grateful. Gratitude for health is a stress buster. It helps us to manage our stressors. It's an immune booster. It makes us more optimistic. And it helps us to deal with adversity. There was a sense of increased belonging post 9/11, post Boston strong, Las Vegas strong, school shootings, bombings, and yes, there will be a sense of increased belonging after coronavirus.
You now know the role of gratitude in health. Tune in for the next session for healthcare audiences. Better yet, invite me to present to your team face to face. Let's schedule that now.